morning. I'm Suparna. Now we are at Niramaya, one of the most famous orthopedic hospital in North Kolkata. Today we have Dr. Amrish Kumar Jha, most renowned orthopedic surgeon in our society. Good morning, sir.
Good morning. Namaskar.
Okay, doctor. Today we want to talk about TKR implants.
Oh,
Okay. Sir, can you elaborate what is TKR implant?
so you have come with a very advanced information. So this is not the basic one. So probably you are focusing on the people who are somehow educated to the basic things.
Yes, sir.
So what are the main components of TKR? So this is probably one of the simplest thing people should understand. There are two components, or rather three components of TKR. One is the upper part, the femur, and the lower part, tibia. So when this tibia and femur articulate, it forms a knee joint along with the kneecap, that is known as patella. So same we do in total knee replacement also. We replace the femoral component, tibial component, and sometimes, not always, it's optional, and we do very less frequently. We do not replace patella. The main components are tibial components and femoral components.
Sir, which material are commonly used in TKR implants?
Okay, the TKR implants are basically, it's a COCR, cobalt chromium implant. It's a medical grade COCR, and now we have come up with titanium implants also. And the thing which is in between that tibial COCR or titanium and the femoral COCR or titanium is the highly cross-linked polyethylene that acts like a cushion between the tibia and the femur. So we have COCR and polyethylene, highly cross-linked polyethylene. Yeah.
Okay, sir. What are the types of TKR implant based on their design, sir?
You see, there are these can be divided according to whether we are keeping cruciate ligament, that is posterior cruciate ligament. The first one is cruciate retaining. We call it CR design. And second one is posterior stabilizing, where we remove the PCL or the cruciate ligaments and put a implant which gives some stabilization inherently. So one is CR and one is PS. And the second thing comes whether this is mobile wearing or fixed wearing. According to that also it has been divided in two groups. Yeah.
Okay, sir. Sir, what is the average lifespan of a TKR implant, sir?
As already we have discussed several times, it may go anywhere between 25 to 15 years. Rather, the average life is 20 years. But yes, it can go beyond that also. It can last lesser than that also.
Okay, sir. What are the common cause of a TKR implant failure, sir?
Yeah, failure of anything is probably a nightmare for the for the surgeon, for us, and for the patient also.
Okay, sir.
So if TKR fails, that is a very grave situation for us, and we really do not want it to fail. But sometimes it happens. The commonest cause being infection. If there is overt or silent infection, it may lead to the erosion of the implants and the underlying bone, and it may fail. Sometimes without any infection, there may be aseptic loosening because of some various reasons. Your body is not trying to, keep it, or the body is trying to repel it. Then there may be sometimes aseptic loosening. There may be some instability when the surgeon could not stabilize the knee properly, and some instability persisted at the time of surgery, and gradually it increased, and that instability itself led to the failure of the components. And maybe post-traumatic ones, when someone falls or faces or have any injury, that may also lead to the failure of the implants. But of course, this is a very grave situation, and we feel very sorry when something like this happens.
Sir,
Yeah.
what is the cemented TKR and cementless TKR? What is the difference?
So this probably we have come with a lot of homework, and this is cemented and uncemented TKR is something which is very recent concept. So we have come up with uncemented TKR where we do not put cement, but the TKR ones which we do right now, most of the surgeons in India and probably abroad also, we do cemented TKR where we use cement, and this is good for all. But now we have come up with cementless TKR where we do not use cement and it is press fit, which is commonly done in very young patients and patients having very good bone quality, and it is done in very few centers in India. And the main problem is there is no long-term data. We don't have sufficient evidence to support this. So better we should not talk about this. And I personally recommend not to jump onto anything which is very new and we don't have assuring long-term results.
Okay, sir. Thank you, sir. Sir, what is the role does a polyethylene play in TKR, sir?
The polyethylene, as I said, polyethylene, it's a highly cross-linked medical grade polyethylene which is put between the tibia and the femur, and it acts like a cushioning effect. In simple words, if you know about meniscus, which is a cushioning soft tissue structure between the tibia and the femur, so it is like that only. So it's between the two, and it prevents the metal to metal movement. It provides a very soft gliding movement between the metal and the polyethylene.
Okay, sir. Sir, how has implant technology improved outcome in TKR, sir?
You see that there are many improvement in implant technology and the instrumentation technology, surgeons, expertise. So many things have been, in advancement for last decade. So now we are come up with a lot of good design, which is day by day increasing. So depending on medial stabilization and patient specific implants are also there. So all patients' needs are not same. So based on that technology, every individual has different need, and according to that, we have come up with the implants which will serve on the individual basis. Number one, and based on the technology you were asking for, it's a robotic knee replacement, and that has really it's a big evolution in mankind. So it is good for other surgeries in other areas, like at your home also robot is almost everywhere, and same is good with us also. So we are now doing robotic total knee replacement, and you will be happy to know that we at Niramaya, where you are sitting currently. So we are going to have a robot very soon, and probably our patient will also get robotic knee replacement advantage in coming days. And I'm pretty sure that the results are going to be better in coming days also. But believe me, robotic knee replacement is not needed in all cases. Sometimes it provides more accuracy and better result, but not always.
Thank you, doctor, for your valuable time.
Thank you.